In today's society, parents and doctors look for a quick fix to control their child's behavior. Attention deficit hyperactivity disorder is one of the most commonly diagnosed diseases in the United States. Children all across America are being diagnosed with this disease and being prescribed medicine that is designed to improve their ability to focus. ADHD is a difficult disease to define, with the symptoms frequently being highly variable and vague. In spite of this, ADHD is regularly diagnosed. The symptoms of ADHD relate to a child's activity and demeanor. As a treatment, parents, teachers, and doctors use medications such as Ritalin and Adderall as a generic method to improve their child's behavior. Doctors examine patients and perform behavioral tests to diagnose ADHD. A frequent method of treatment involves the use of medications called central nervous system stimulants to manage the patient's brain activity. This then helps to reduce the negative effects of ADHD. Since there is no exact neurological test to diagnose ADHD, doctors overprescribe CNS stimulant medication to children throughout the United States.
As the incidence of ADHD continues to rise among children in the United States, more and more young people are utilizing medication to help them alleviate the symptoms. Children with ADHD struggle with attention, planning, and alertness. ADHD is a disorder that many children suffer from. UBIG notes that there is an estimated worldwide prevalence of 5.29% attention deficit hyperactivity disorder. UBIG also reports that this is the most common neurobehavioral disorder diagnosed during childhood. Despite progress in the assessment, diagnosis, and treatment of ADHD, this disorder and its treatment options have remained controversial. The most contentious yet popular remedy is the use of CNS stimulants. Although an independent diagnostic test for ADHD does not exist, there is some evidence supporting the validity of this disorder. According to diagnosis and treatment of attention deficit hyperactivity disorder, due to the lack of a specific neurological test, there is the potential for overdiagnosis of this diverse neurological syndrome. In correlation with this potential overdiagnosis, millions of children are prescribed medications that are unnecessary. These medications could potentially be detrimental to a child's growth and development, as this disease process does not have a clear-cut set of symptoms, and as to date, there is no reliable testing method. The possibility of medication overuse is significant. When parents or teachers recognize that a child behaves differently than the rest of the children their age, they are frequently concerned about a diagnosis of ADHD. Parents or teachers may be troubled when they see excessive talking, issues with organization, and are easily distracted, though oftentimes teachers and parents can misread the signals of their child. In normal circumstances, the teacher will contact the parent with concerns about their child's behavior in class. This will lead to the parents taking their child to a doctor to be examined. There are many indicators that doctors look for when diagnosing a child with ADHD. Physicians will go through a diagnosis process starting with a consultation, then a series of tests, and last an evaluation of the final results. In addition, as many as 50% to 60% of people diagnosed with ADHD also meet the diagnostic criteria for another major psychiatric disorder, such as anxiety disorders, depression, and antisocial personality disorder, according to Davidson. What frequently makes this diagnosis controversial is that many of the symptoms that physicians look for are also commonly seen in normal children. Most children tend to purely have behavioral issues rather than ADHD. As one can see, this disorder is based off of very little science, which leads to millions of children in America being diagnosed with ADHD. Frequently, kids will be diagnosed with ADHD when they are not even affected by this disease. In modern times, there are a variety of factors that can contribute to a child struggling with paying attention. Lunsky and Gomes notes, then consider the stressful environments that can lead to difficult behaviors, exhausted caregivers who lack support, and education and labor systems that too often ignore the special needs of those with special development disabilities. There's a large range of explanation of why a child may behave differently. In addition, according to Leo, many people argue that scientists created this drug due to the success it would have with parents and the public. This theory dates back to the start of the use of Ritalin and Adderall. These drugs have lured in millions of parents with the beneficial effects it would have on their child. With that being said, there are many negatives to the overprescription of ADHD medication. Ritalin and Adderall are commonly known to have a variety of side effects that can put children at risk for many health issues. Brain stimulant medications such as Ritalin and Adderall do not contain major side effects, but there are still a variety of concerns that need to be addressed when a child is receiving these medications. Lunsky and Gomes address that many children have noticed mood swings, loss of appetite, and difficulty sleeping at night. Although these symptoms are not severe, they can make a major difference in the performance of a child. In addition to these side effects, many people have seen long-term side effects when on CNS stimulant medication. When a child is on the medication for their entire young life, their brain is trained to act a certain way. And according to Ubig, the day that they stop taking the medication, they do not know how to act like a normal human being because their brains are wired in a certain way. Moreover, Ritalin and Adderall do not cause life-threatening factors for a child, but there is an array of other methods that should be considered before putting a child on CNS stimulants. It is commonly seen that children with mild signs of ADHD will be prescribed Ritalin or Adderall when in actuality they just need to make some lifestyle changes. Some lifestyle changes that could be implemented in the child's life are better eating habits, less screen time, and more sleep. Also, many doctors tend to confuse other ailments with ADHD. In his argument, Newmark says that learning disabilities, anxiety, sleep apnea, and child abuse, or a child being gifted, can cause symptoms that may be misdiagnosed as ADHD, and too often practitioners don't take the time needed to make that distinction. Parents that have rejected the use of ADHD medication have seen similar results when taking other precautionary steps with their child. While there are alternatives to helping with ADHD, there are millions of children that do struggle with this disease and need these medications to help them. It is important to remember that ADHD is a real issue among children. There are millions of people that suffer from this disease, but parents and doctors have taken advantage of these medications as a quick fix for their children, according to Koplowicz. There needs to be a clear distinction between a child that suffers from ADHD and a child that is just not maturing as fast as the other children their age. Koplowicz also states, there needs to be better training of the pediatricians who write most of the prescriptions for ADHD. We need better monitoring to make sure the medication is effective, and we need more cooperation among all those who can offer insight into an individual child's behavior. Attention deficit disorder is a real disease that needs to be taken more seriously. Doctors and parents need to ensure that their child is accurately diagnosed with ADHD before prescribing medication that they do not need. Medications such as Ritalin and Adderall are being overprescribed to children due to the lack of a scientific testing for attention deficit hyperactivity disorder. ADHD medication is being abused every single day, and doctors need to develop a system that is most safely guaranteed. Children are being exposed to these stimulants that are training their brains how to think. There needs to be a more secure and scientific test for ADHD in order to stop this epidemic. Every day, children are being drugged and suppressed by the use of stimulants. Thank you and good night.